Thank you very much, Bobby. Emeritus Professor Eric Bateman, the founding director of the UCT Lung Institute, Associate Professor Rodney Dawson, Managing Director, members of the UCT Lung Institute, past and present, UCT colleagues, representatives of our partners from the national, provincial, and local health departments, representatives of the Boehringer Ingelheim, whose founding donation enabled the institute to be built. I was trying to get the pronunciation of the name, Boehringer Ingelheim, and I thought, what if I get it wrong? So Professor Bateman said, practice again, and I thought, okay, I got it. I thought, if I don't get it, I'll just say to them, please pronounce my name, and see what happens. And then, of course, my name is very tricky. Whatever they do, I'll say, you didn't get it. Because there's two sounds you must pronounce, the k and the ph. And the ph you can pronounce either as in philosophy or as in parking. And if you pronounce it as in philosophy, you'll be swearing at me. If you pronounce my surname with the ph as in philosophy. So that will be a catch, right? But we're not going there. So I'm glad that I think I got Boehringer Ingelheim correct. And we have to thank them for enabling the Lung Institute to get started that many years ago. Thank you also to other industry partners who are in the audience tonight. On behalf of my colleagues at the UCT Lung Institute, I want to convey a heartfelt delight that we all share at being able to enjoy this evening with all of you. And you look amazing. I was looking around. In fact, our videographer couldn't even recognize me. He says, I'm always well-dressed, but not tonight. And this is a wonderful, it means it shows how beautiful it is tonight. The UCT Lung Institute's growth and its many accomplishments over the last 20 years provide dazzling examples of how you address priority health issues through education, research, and service. And these are the words on your building, and they truly have guided your work within those walls in the community. These words intersect powerfully with the vision of UCT. African-sourced education, research and service is at the heart of our mission as an institution. I took up office as VC last year on the 1st of July with the belief that it is not enough for us as UCT to be the best university in Africa. To be relevant to the world's needs and sustainable as an institution, we also need to be the best for Africa. And the work of the UCT Lung Institute is now at the heart of many national and international projects in the field of HIV, TB, public health, primary health care, allergy treatment, and others. Our research teams in the Institute produce more than 100 scientific papers annually, and this business model is seen as a unique innovation in the field of healthcare. Emeritus Professor Eric Bateman, the founding director, and Associate Professor Rodney Dawson, the managing director, will discuss the growth and impact of the Institute in more detail later. I want to particularly acknowledge the drive that Professor Bateman and his passion to build a unique home for pulmonology and translational research. The idea of building a lung institute was itself an innovation that has proven its worth over the years. And this is a lasting legacy to Professor Bateman's hard work and creative thinking. I also salute the leadership of the Department of Medicine, and the UCT Faculty of Health Sciences, and the members of the university senior management of 2 decades ago, led by Dr. Mampele Rampele, the Vice Chancellor at the time, for providing an environment where this caliber of innovation and entrepreneurship could flourish. The UCT Lung Institute represents African excellence in 6 broad areas. In many ways, the UCT Lung Institute helps us say we are becoming the best for Africa. And you help us say that by what you do. And I'll just mention the 6 broad areas. First, it's allergy and immunology, headed by Associate Professor Johnny Peter. He has pioneered work in African allergies, including allergy treatment, as a specialty in healthcare and understanding African allergies in particular. Second is child and adolescent lung health, led by founding head Professor Heather Zah, who provides world leadership in the study and treatment of pediatric and adolescent pneumonia and respiratory disease. Third is the TB research innovation, led by founding head Associate Professor Rod Dawson, who has driven international policy on drugs and diagnosis for tuberculosis and has addressed priority health issues through education, research, and service. Focus areas include TB drug development, HIV-TB interaction, and understanding adherence to medication in drug-resistant TB. And fourth is lung infection and immunity, led by founding head, Professor Kirtan Deda. He develops academic, clinical, and laboratory activities to design new diagnostics and improve health-related quality of life of people with lung infections associated with poverty, such as TB, HIV, and pneumonia. And fifth is lung clinical research, which is headed by Professor Richard van Zyl-Smit, who addresses priority health issues around lung health in Africa through laboratory research to understand mechanisms of disease related to tobacco and indoor air pollution, the training of healthcare professionals, the provision of clinical service to those living with respiratory disease, and partnerships to develop new respiratory medications. And sixth is the Knowledge Translation Unit, led by founding head Professor Lara Feo. She has taken African-based research and treatment expertise to Botswana, Brazil, Ethiopia, Malawi, and Nigeria via the PAC initiative, the Practical Approach to Care Kit, which empowers frontline providers to provide evidence-based primary health care through the use of its printed guides, of which almost 200,000 copies have been distributed. In South Africa alone, more than 30,000 nurses have been trained, and PAC forms a key element of the Ideal Clinic program and intensified efforts to realize the UNAIDS 1990 targets for HIV. More than 40 other countries have asked for assistance in adopting PAC in their health systems. Evolution and evaluation of PAC has been reported in over 60 publications in peer-reviewed journals involving 90,000 patients from hundreds of clinics. This is testimony to the quality of the PAC initiative and its relevance and resonance with healthcare providers in low-resource communities around the world. The Institute provides significant support to the clinical services and training in pulmonology and allergology at Groote Schuur Hospital and to local TB and regional hospitals. It has provided employment and training in research for specialists waiting for clinical training positions in pulmonology in Groote Schuur, and for pulmonologists awaiting permanent employment in the provincial services. You see, this is when I stop and make you pronounce my name so that we can square up. Of course, in some years, a training post in pulmonology has even been funded by the Institute. These contributions have resulted in the growth of the Division of Pulmonology and Groote Schuur to the status of the premier unit in Africa, at a time when divisions in many other universities have been in decline. I want to thank the dedicated colleagues, the hardworking teams, as well as the unit heads who apply their considerable talents and skills to addressing these lung health issues in our country and our continent. These colleagues include world leaders in their respective fields who could command prestigious positions anywhere in the world, but they choose to be with us here at UCT. And by choosing to work here, you are not only providing solutions to your relevant health problems, you are also helping to produce future generations of academic leaders for South Africa and for our continent. The continuing work of the Lung Institute is a testimony. It's a testimony also to all of you who provide the network that makes this work possible. The supporters, the funders, the partners, the industry sponsors who embrace the mission of the Institute to serve as a center of excellence for the study and application of knowledge and health in diseases of the lung and respiratory tract relevant to the needs of Southern Africa. This evening, we invite you to share in a well-deserved sense of accomplishment as a result of the last 20 years, and to recommit your support for even greater accomplishment in the years ahead. I guess this evening is also an opportunity for all of us who support the work of the Lung Institute to recommit ourselves to making sure that it continues to happen for the next 20 years, if anything less. Congratulations to the UCT Lung Institute, its founding members, its current members, and all of those whose partnership has made this wonderful work possible. It is so fitting that we are celebrating with a gala ball dinner, an evening that demands that we express our joy in dance. And Bobby, I wanted to wait to stay here for the dance, but I looked around, and I realized if I stay for the dance, I might just make other people feel inadequate because... So I'm sorry that I'm not going to stay for the dance and experience the music. And so colleagues, please, when time for the dance comes, I encourage you to come to the floor. I used to be a competitive dancer. I promise you I will not be here. I will silently exit so that you feel comfortable and you dance your heart out. So I wish you all to enjoy this well-deserved sense of accomplishment as we celebrate 20 years of the Lung Institute. Thank you very much.